Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Foot health. Introduction. Healthy feet are strong and flexible. Feet support the weight of the whole body and allow us to walk and run. Your foot health can be a clue to your overall health. Good foot care and regular foot checks are an important part of your health care. This program explains foot health. It discusses the anatomy of the feet, how to take care of your feet, and how to select the best footwear to prevent problems. Anatomy of the foot. The feet consist of many bones, joints, and soft, flexible tissues. The bones and joints of the foot help absorb pressure from the body's weight. Joints act as hinges. They separate bones. Joints, along with muscles, let the foot and toes move. Joints are covered by fluid-filled sacs that act as cushions. The sacs are called bursae. The foot has 5 toes. The big toe is called the hallux. Each toe, except for the big one, is made of 3 bones or phalanges. The big toe only has 2 bones. Ligaments surround each joint. The ligaments hold the bones together. 2 tendons run along the bottom of each toe. These tendons allow us to curl our toes. A tendon that runs along the top of each toe allows us to raise the toes. The plantar fascia is a band of tissue that starts at your heel and goes along the bottom of your foot. It attaches to each one of the bones that form the ball of your foot. The plantar fascia works like a rubber band between the heel and the ball of your foot to form the arch of your foot. If the band is short, you will have a high arch. If it is long, you will have a low arch or flat feet. A pad of fat in your heel covers the plantar fascia. It helps absorb the shock of walking. The Achilles tendon is a strong fibrous cord. It connects the muscles in the back of your calf to your heel bone. Foot problems. Foot problems can be caused by wearing shoes that do not fit. Aging and being overweight also increase your chances of having foot problems. Jobs that require long hours standing or walking can take a toll on your feet. Exercise and activities that involve running and jumping may also cause foot problems. People with diabetes are more likely than others to have problems with their feet. These problems include numbness caused by nerve damage, narrowed blood vessels, and dangerous infections. Osteoporosis is a disease that causes a loss of bone mass and density. This condition increases the risk of bone fractures. Osteoporosis often develops unnoticed over many years with no symptoms. One of the first places in the body that osteoporosis noticeably affects is the feet. A stress fracture in the foot is often the first sign of the disease. Other common foot disorders that affect adults include bunions, calluses and corns, plantar warts, fallen arches, also known as flat feet. A bunion is a hard bump at the base of the big toe. It happens when bone or tissue grows around the joint. It can cause the big toe to point inwards towards the other toes. Over time, improperly distributed weight across the foot can cause a bunion. This can enlarge the joint at the base of the toe. Improper weight distribution is usually the result of tight-fitting or high-heeled shoes. It can also be caused by injuries to the foot and the foot's shape. An inherited foot problem or arthritis can also cause bunions. Corns and calluses are thickened patches of skin. They are caused by pressure or friction on your skin. They often appear on feet where the bony parts of your feet rub against your shoes. Plantar warts are non-cancerous growths on the soles of your feet. They are caused by an infection with human papillomavirus, or HPV. HPV enters your body through tiny cuts, breaks, or other vulnerable sites on the skin of your feet. Fallen arches are a common condition. You have flat feet when the arch on the inside of your feet is flattened. This allows the entire sole of your foot to touch the floor when you stand up. It is normal for babies and toddlers to have fallen arches. The tendons that hold the joints in the foot together tighten and form an arch as a child grows. Pain in a child's foot or ankle is never normal. Any pain that lasts more than a few days or that is severe enough to limit the child's walking should be evaluated by a healthcare provider.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Taking care of your feet. To keep your feet healthy, examine them regularly. Look between your toes. Check for any changes, such as redness or swelling, growths, warts, or blisters, skin changes, such as corns, calluses, and cracks, scratches or cuts. Checking your feet every day is especially important if you are a person with diabetes. You may be able to notice small problems before they become serious complications. To prevent osteoporosis-related foot fractures and keep the bones and muscles in your feet strong, exercise regularly. Consume the recommended amount of calcium and vitamin D. Wash your feet every day using soap and warm water. Dry your feet carefully, especially between the toes. Apply lotion to dry or cracked skin and to the soles of the feet. Do not put lotion between the toes. Apply lotion to dry or cracked skin and to the soles of the feet. Do not put lotion between the toes. Keep your toenails neatly trimmed. After a bath or shower, cut the toenails along the shape of your toes. They should be cut so that they are even with the skin on the end of your toes. Avoid cutting down into the corners. Never cut skin on the end of your toes. If you have trouble seeing, have someone help you trim your toenails. If your toenails are thick, they may need to be trimmed by a healthcare provider, such as a podiatrist. If you have corns or calluses, contact your healthcare provider. Do not attempt to remove them on your own. To prevent foot injuries, avoid walking barefoot. To prevent burns, wear shoes if you walk on hot sand. Before washing your feet with warm water, check the water temperature with your hand or elbow. Check the insides of shoes before putting them on. Small objects or torn linings may create pressure points. These can cause irritation or infection. Footwear. The right shoes and socks can protect the feet and keep them healthy. Wearing properly fitting shoes is the best way to prevent foot problems from happening or from getting worse. Wear comfortable shoes that fit your feet. The toe end should allow all toes to wiggle. Find a shoe that fits the shape of your foot as closely as possible. Your feet may not be the same size as each other. Fit your shoes to the largest foot. Special pads for your shoes can be used to help distribute weight more evenly. Prescription orthopedic shoes and inserts may also help. Keep your feet warm in the winter and cool in the summer with appropriate footwear. Wear protective footwear when using lawnmowers or chainsaws, moving heavy objects, working around chemicals. Avoid tight, pointed, or high-heeled shoes. Avoid open-toed or open-back shoes to prevent possible injury. Wear clean socks and change them every day. Avoid socks with tight elastic.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Healthy feet are strong and flexible. Feet support the weight of the whole body and allow us to walk and run. Your foot health can be a clue to your overall health. Good foot care and regular foot checks are an important part of your health care. Foot problems can be caused by wearing shoes that do not fit. Aging and being overweight also increase your chances of having foot problems. Jobs that require long hours standing or walking can take a toll on your feet. Exercise and activities that involve running and jumping may also cause foot problems. To keep your feet healthy, examine them regularly. Look between your toes. Check for any changes, such as redness or swelling, growths, warts, or blisters, skin changes such as corns, calluses, and cracks, scratches or cuts. The right shoes and socks can protect the feet and keep them healthy. Wearing properly fitting shoes is the best way to prevent foot problems from happening or from getting worse.
Thank you for using Explain.